Hi, I'm Dr. Taylor Shank. I'm a licensed clinical psychologist. While I do generalized therapy, I also have specialized training in perinatal counseling. If we think about the word perinatal, peri meaning around and natal meaning time of birth, so that kind of encompasses perinatal therapy around pregnancy and then postpartum. So perinatal depression and perinatal anxiety are quite common. The research shows that 1 in 4 birthing people has those experiences, so it is very common. It is absolutely nothing to be ashamed about or feel like it's your fault or that you have done something wrong. Biologically, there's a lot of changes happening in your body with your hormones. There are a lot of changes with just your identity. A big part of starting therapy is that I want patients to know that what they say to me is confidential. I take patient privacy very seriously. So I try to be very clear about those kinds of things at the start of therapy, and that we just really feel like we have a strong alliance in working through whatever's coming up for you. And then as we're moving towards the end of therapy, some of the goals I have for my patients are that they just feel more empowered to manage their emotions, to maybe feel a greater sense of authenticity with like a deeper knowing of themselves, a greater sense of their autonomy and their freedom to make their choices that align with their values, maybe rather than choices being kind of determined by fear or worry or anxiety, that you've gained the skills to kind of manage that anxiety, work with that anxiety, understand it, so that it's not getting in the way of you living the life that you want, and that you are experiencing a sense of well-being in your life. Maybe that looks like confidence or just feeling capable. So those are some of the goals I would say that I have for my patients.